This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about what happens if a slipped disc in your back goes untreated. The short answer is most of the time nothing, but sometimes it could be really bad. So it just depends. So the discs in your back act as shock absorbers between the vertebrae of the spine, and you have a fair amount of them, one between each level. And sometimes what can happen is it's almost like squeezing the jelly out of a jelly donut. The part of the disc will kind of bulge out, and it'll push on the nerves that come out of your spine, and will usually cause pain and tingling that travels down the back of the leg, or sometimes down the front of the leg, depending on which nerve the disc happens to push on. So slipped discs are pretty common. Actually, in people that have back pain and people that don't have back pain. After a certain age, if you get an MRI of someone's back, they'll have discs in there that are slipped even though they have no pain. So what happens if you have a painful slipped disc in your back and it goes untreated? So 90% of the time your body will resorb that disc, meaning that it will kind of suck the jelly kind of back into the donut. It doesn't mean the disc, it's more like it just gets rid of the jelly, I should say, not really that it sucks it back in. So most of the time people end up getting better. I mean, that assumes that you do some sort of, you keep up with activity and you don't just lie in bed. So by and large, that's what happens if you just let them go. And untreated, meaning that you don't do surgery. You can always do some home exercises too if you can't get around to doing normal physical therapy. In the 10% that don't, sometimes they continue to push on a nerve in the back, and if that's bad enough, then that's something that you may need surgery where they can actually go in and remove a little piece of that disc, or if there's other degenerative changes, they'll actually fuse your spine. Both can be good surgeries, not so much for pain in the back, but more for pain that travels down the leg, because they can reliably take pressure off the nerves. As far as curing the back pain itself, you're looking at 50-50. The one time where it can be really bad if you have a slipped disc in your back and it goes untreated is if you get a massive herniated disc or slipped disc and it pushes on the spinal cord sac. Now at that point, usually the spinal cord is not really the cord anymore. It's something called the Cauda Aquinas, which just means a bunch of nerve roots. It's more of just a medical thing. But basically what happens if you get a giant slipped disc, you can get something called Cauda Aquinas syndrome, which means that if you let that go, you sometimes will lose the ability to walk and lose permanent function of your bowel and bladder. That's a surgical emergency and it needs to be fixed within 48 hours. Usually you'll know if you have that because the pain is excruciating. You can't control your urine, plus or minus bowel, and you have something called saddle anesthesia, which means that you have numbness on the inner aspect of your thigh. You can't see anything. So if that's something that you're experiencing, you should certainly go to the emergency room as soon as possible. And you'll need an MRI and have to have a spine surgery within a day or two. But that's a rare minority. Most people, it's a slipped disc, it's plus or minus pressing on a nerve, they do some physical therapy and movement and it goes away. So I hope I was able to answer your questions about what happens if a slipped disc goes untreated. If you have any questions I didn't answer, feel free to ask them in the comments below and I'll do my best to respond. If you like this video, we put out new content every Friday, so please like and subscribe, and thanks for watching.